All right, today we're jumping into something that's, well, it's kind of hiding in plain sight. It affects millions of people, and it takes one of the most basic rules of health, drink water, and flips it completely on its head. We're talking about hyponatremia.
You know the drill, right? We hear it constantly. Drink more water. Hydrate, hydrate, hydrate. But what if that advice goes wrong? I mean, really wrong. How can the one thing that is essential for life, water, suddenly become dangerous? How can it push our body into a full-blown, life-threatening crisis?
Okay, just look at this number. 1 in 3.
So what does that mean?
Well, that's how many patients in the hospital might actually have this condition. We're not talking about some super rare, obscure disease here. This is literally the most common electrolyte problem that doctors run into. And yeah, it can have some really serious consequences. So let's get into it. Let's figure out what is actually going on.
So that brings us to the big question, this central paradox. How on earth can a body have too much water? It sounds impossible, right? But this is the key we've got to unlock. So let's get the official definition out of the way. Medically speaking, hyponatremia is when your blood sodium level dips below 135. That's the magic number to remember. And why does sodium even matter? Well, it's absolutely crucial for pretty much everything. Your nerves firing, your muscles contracting, keeping your body's fluids in check. So when that number drops, things can go sideways. And I mean fast. Okay, this is probably the biggest misconception out there, so let's clear it up right now. When you hear low sodium, your brain immediately thinks, oh, I just need to eat more salty chips, right? But that's almost never the real issue. The reality is, it's a water problem. It means there's too much water in your body compared to the amount of salt you have. Think about it like this. Imagine you've got a glass of salt water, and it's just right. The amount of salt in there is perfect. But then you start pouring in more and more plain water. What happens? You're diluting it, right? The salt concentration goes down even though you haven't taken any salt out of the glass. That's exactly what hyponatremia is. It's not a salt problem, it's a dilution problem. That's the key takeaway.
All right, so if it's all about dilution, then what's causing it? Let's put on our detective hats for a second. We're going to investigate the main suspects behind this whole mess. And it turns out they pretty much fall into 3 main categories. So, suspect number 1. This is a case where your body is losing a bunch of salt and water together, but then you only replace it with plain old water. You can probably picture this pretty easily. We're talking about things like a really bad stomach bug with lots of vomiting or diarrhea, or maybe someone's on water pills, diuretics, or think about a marathon runner just sweating buckets for hours. In every single one of those cases, your body is losing both salt and water. And if you try to fix it by chugging tons of only plain water, boom, you've just created that exact dilution problem we were talking about. Now, suspect number 2 is a totally different story. In this case, your body isn't really losing anything. Instead, it's acting like a dam that's about to burst. It's holding on to way too much fluid and just can't get rid of it. You see this a lot with some major medical issues. For example, with congestive heart failure, the heart's just not a strong enough pump, so fluid starts to back up everywhere. Same kind of thing with serious liver or kidney disease. The body's systems for managing and getting rid of water just aren't working right. The end result is a total body fluid overload, and all that extra water, it just dilutes all the sodium. And that brings us to our third and honestly most interesting suspect. This is the tricky one. On the outside, the person's fluid levels look normal, not dehydrated, not swollen, but inside, there's still too much water compared to the salt. So what in the world is going on here? Well, a lot of the time it's a hormone issue. There's this hormone called ADH, and sometimes it just goes haywire. It starts screaming at the kidneys to hold on to water, even when they absolutely shouldn't. That's a condition called SIADH. Certain drugs can set this off too, some antidepressants, even MDMA. But it's not always so complex. It can also happen just by drinking so much plain water that you overwhelm your kidneys. Or, weirdly, from diets that have almost no salt or protein, because it turns out your kidneys actually need that stuff to, make pee properly. Okay, so we've got our 3 main suspects. With so many potential culprits, how does a doctor actually figure out which one is the bad guy in any given patient? Well, it's all about good old-fashioned detective work, following the clues to crack the case. First, they just talk to the patient. What are your symptoms? What pills are you taking? How much water have you been drinking? Then they'll do a physical exam. Are there signs of dehydration? That points to suspect number 1. Or are there signs of fluid overload, like swelling? That points to suspect number 2. And the final, crucial clues come from the lab. They test the blood and the urine, measuring the sodium levels and how concentrated the urine is. That's what really helps them nail down the perp. All right, case cracked. The doctor knows the cause, but now comes the hard part, the treatment. And let me tell you, this is not as simple as hooking someone up to a salty IV. No way. This is an incredibly delicate, super high-stakes balancing act. And here is where the biology is just mind-blowing. See, when the sodium in your blood drops, water follows its natural course and rushes into your brain cells, causing them to swell up. That's called cerebral edema, and it is very dangerous. But the brain is smart. To protect itself, over the next day or two, it starts pushing out its own internal stuff to even things out. It finds a new, stable, but very, very fragile equilibrium. And that brilliant, life-saving adaptation, that's the very thing that makes the treatment so incredibly risky. Because now the brain is walking on a tightrope. It's in this super fragile, adapted state. So picture that tightrope. If you correct the sodium too slowly, well, the brain keeps swelling, and that can lead to seizures, coma, it's bad. But if you go too fast, you cause a catastrophe. The sodium in the blood shoots up, and all that water gets violently ripped out of those adapted brain cells. They shrink, they shrivel, they basically self-destruct. And that leads to something truly devastating. That something is called Osmotic Demyelination Syndrome, or ODS. This isn't something you recover from easily. It's a severe and often permanent type of brain damage where the protective coating around your nerves gets stripped away. It can leave a person paralyzed with movement problems like Parkinson's. It can even be fatal. This is the absolute nightmare scenario, the one thing every single doctor is trying to avoid. And that is why the treatment rules are so incredibly strict. The goal is to raise the sodium level by just a tiny controlled amount, like 4 to 6 points in the first few hours. Just enough to take the immediate danger off the table. But the absolute do not cross red line limit is no more than 10 points over an entire 24-hour period. That is an insanely narrow target to hit, and it means doctors have to be watching the patient like a hawk. Okay, so we've walked through this whole complicated, dangerous condition. What's the big takeaway here? Why does any of this matter to you or me? Well, I think it really shows us that sometimes the simplest health advice, drink more water, is actually way more complicated than it seems. Hydration isn't just about how many glasses you chug a day. It's about balance. It's this beautiful, complicated dance between water, salts, hormones, a dance your body is performing every single second to keep you alive. And when that balance gets thrown off, it's a pretty stark reminder of just how incredibly complex and amazing our bodies really are.